for the vision recording is application of a trial frame. The patient is asked to apply the trial frame in front of the eye, and a occluder is used to close one eye. So the right eye is open now and the left eye is been closed with an occluder. So the patient looks straight into the Snellen chart. So here are the recordings of the Snellen chart. So if the patient is able to read the last line, then the vision is recorded as 6/6. Then again you change the patient again. So if the patient is able to read only the last second line, the vision goes into 6/9, or if the patient is able to read only the last third line, the vision goes to 6/12. If the patient is able to read the last fourth line only, then the vision is recorded as 6/18. If at all the patient reads only the top third line, then the vision is recorded as 8 or the 6/24. If the patient is able to read only the first two lines, then the vision is recorded as 6/36. If at all the patient is able to read only or recognize only the top first line only the first line, then the vision is recorded as 6/60. After the distant vision is recorded, we go to the patient and apply a pinhole in front of the right eye, and the patient is asked to read again. If the patient is able to read a few lines more than what he read in the previous situation, that improvement is noted down. Now come to the final situation wherein the patient is not able to read even the top first line. Then the vision is recorded in terms of counting fingers. For this, the examiner is going to stand at a distance of 5 meters from the patient. So the examiner keeps showing the fingers at a distance of 5 meters and asks the patient to recognize how many fingers are present. So now if the patient is able to recognize or count the fingers with this situation, the vision is recorded as counting fingers 5 meter. If the patient is not able to read at a distance of 5 meters, the examiner comes 1 meter forward. That means the patient and the examiner are 4 meters away from each other. Now again the patient tries to count the fingers. If at all is able to recognize, the vision is recorded as counting finger 4 meters. If the patient is not able to recognize the fingers at the distance of 4 meters, the examiner comes to the 3 meter distance and asks the patient to count the fingers. If the patient is able to count the fingers, the vision is recorded as counting finger 3 meters. If patient does not recognize the fingers at the distance of 2 meters, the examiner is going to come to 1 meter distance and is asked to count the fingers. If the patient fails to count the finger at the distance of 1 meter, now the recording of vision comes to the hand movement method. During hand movement recording, the examiner goes close to the patient's face and tries to wave his hand from side to side. If the patient is able to recognize this movement, the vision is recorded as hand movements. If the patient fails to recognize the hand movement also, the next way or the method of recording vision is perception of light. For this, now the examiner throws light onto the pupillary area and asks if the patient is able to recognize the light. During this examination, the left eye is completely kept closed with the palm of the left hand of the patient so that no light falls onto the eye during the right eye examination. So if the patient recognizes the light falling onto the patient's eye, the vision is recorded as PL plus. Once the patient is able to recognize PL plus vision, now we record the projection of light. Now light is thrown from the nasal side horizontally and the patient is asked to recognize the direction of the movement of the light. The patient answers the direction of the light with this finger. Now the examiner changes the direction of the light and puts the light from the temporal side. Now the patient responds whether he is able to recognize light or not, and the direction also. After this, the vision is now recorded from the superior side. The light is thrown from the top, and the patient, if the patient is able to recognize the light, then it's taken is going to give an indication the direction of the light. Now again the repetition of the same procedure from the lower direction or the inferior aspect. So the patient again recognizes the light and gives an indication that is able to see. So this is how you are going to record clinically the vision for PL recording. Thank you. After the recording is been done for the right eye, the occluder is now shifted to the right eye, and the recording of the vision again started from asking the patient to read the distant Snellen chart. And if at all the patient is able to read again until the last line, the vision is taken as 6 by 6. The vision recording goes on with 6 by 6, 6 by 9, 6 by 12, 6 by 18, 6 by 24, 6 by 36, and 6 by 60 when according to the patient's vision. If at all the patient fails again to recognize the first letter, the vision continues for the hand movements, counting finger hand movements, and PL plus. So this is the simplest way to record vision in a patient coming to the hospital in the refraction unit. Thank you.